Good afternoon, good morning, good evening. The name is Dumsani Mamba, Africa Cdc Mental Health Technical Officer. It is an honor and a privilege for me to be here doing a presentation on behalf of Dr. Mohammed and Dr. Adelat, who were initially going to be the ones doing the presentation. I'm going to take us through what I will say it's a very brief presentation on what Africa CDC has done and is doing with regards to the integration of mental health psychosocial support in emergency preparedness and response across the continent. The first thing I would like to highlight is we recently we just came out from launching a document which I would say is an achievement and a milestone for Africa CDC, the launch of the non-communicable diseases and injury mental health strategy, which is like the first strategy by Africa CDC. This will actually speak to what we have always been missing as a continent with regards to mental health and integration of mental health services into emergency response and preparedness. So from Africa CDC perspective, I think we might probably all be aware how Africa CDC operates. We work with member states, we work with the ministries of health, we work with the National Public Health Institutes, where we integrate and work with them in terms of providing technical support, providing resources if available, and also providing support and in nurturing and establishing health systems that are going to be stronger for the continent. So the first thing one would want to highlight is with the validation of this document, the document has been developed through a very consultative process, which was, I would say, it's the bottom-up approach. Since with Africa CDC, we are serving member states. So most of what is in the document is a document created and formulated by member states through coordination by Africa CDC. We have done consultations with the ministries of health through the NCD's department, mental health department, but for the interest of today's discussion, I'll focus more on the mental health aspect, that we have consulted with mental health experts across the globe and across the continent specifically and mostly. And we have also consulted with people with lived experience because we wanted to make sure we integrate everyone and we have everyone as part of this document that we are working on. So the document was validated last week with member states from all walks of the continent. To be specific, we had 42 member states participating in the validation and launching of the document, which is a very good number, considering that we are a continent of 55 member states. So having 42 literally says we almost had everyone. And for those who were not able to come through, they had contributed to the development of the document. To get us started, there's one would want to ask, where is the continent going with regards to MHPSS and what strategies are in place? The first thing I would want to highlight is, as Africa CDC, we have a division that specifically looks at emergency preparedness and response. And as the mental health unit, which is housed under the Division of Disease Control and Prevention, we are working hand in hand, trying to make sure that integration of mental health and psychosocial support is an integral part of our sister division on emergency response and preparedness, because we have realized, as we have been speaking and we have heard from the presentation just made just not long ago, the previous one, about the evidence that speaks to mental health and mental health being an integral pillar of health systems. And as Africa CDC, we are very cognizant of that. And we are very much aware of this is what we need to do. And as different divisions within the same institution, the biggest thing we can do is working hand in hand in making sure we integrate mental health into emergency preparedness and response. And that is evidenced by one of the biggest objectives we have actually in the strategic document, which is objective number 1, which reads enhancing the capacity of ministries of health and PHIs to develop, integrate, and implement national policies and supernatural frameworks and policies for mental health prevention and control. That basically speaks to how are we as Africa CDC seeing mental health as a priority in the integration of mental health in emergency response and preparedness, and also in health systems. Because one of the biggest mandates for Africa CDC is health system strengthening. And we cannot do that if we've got shaky emergency response systems. So that's one of the biggest objectives. And As Africa CDC, we are very proud about that, since it's something that has been lacking in one of the things that we're working on, mental health. As it was said by Rosemary earlier in her opening remarks, that there has been a lot of neglect on mental health. And with that, it has also been neglected in situations where you definitely need to have a mental health system in place, which is in emergencies and response. So with this particular objective, we are very excited that we are doing something to integrate and make it within the national policies of the member states, because this document was developed by member states. It's not Africa CDC telling member states to ABC. It's member states requesting assistance from Africa CDC in integration of MHPSS and emergency response and preparedness plans. And with that being said, one would also wonder then that we have a good document as we want to see it being a good document. We're looking at what's the commitment that comes with it. What is there that is going to be binding, that is going to be enforcing and influencing member states to do these activities? From where we are as Africa CDC, we are working with member states, like I've been saying, and the biggest thing that we have is the political power of the African Union. Because Africa CDC is a public health institute of the African Union, where the members or the heads of states sit together to discuss Africa issues, particularly health issues, driving them through Africa CDC. When we have this kind of a document coming from Africa CDC, we are literally having a document that can wield certain power to the member states to say, now we have this, we have to integrate this, because it has been endorsed by the African Union, which literally binds everyone who is a member state who participated in the validation of this document to say, in all the national emergency preparedness and response plans, we need to have a pillar on MHPSS, which is one of the biggest things. And as we are working around with that, I would just want to highlight that in the people we had participating in the meeting last week, we had 7 ministers coming in for this meeting to endorse and validate this strategic document to say, we know it's here, we appreciate it, and with the political influence of ministers present, we know we have commitment from all the member states, from all the governments, from all the heads of state that are subscribers to the African Union charters, and particularly to African Union public health issues, as it has been seen in COVID-19 and all these other emergencies that have been popping in the continent. And that brings me to another component of it. I just want to highlight that we have already started. It's not that we were waiting for the document to come in place. Early this year in February, Africa CDC, in partnership with other collaborating organizations within the African continent and internationally, we had a regional workshop on the integration of mental health and psychosocial support in one of the regions, which was in the West, having countries like Liberia, Sierra Leone, Cameroon, Nigeria, and other partners participating in what was a workshop to learn more about the experiences we have as a continent in responding to emergencies, lessons learned, and what we can take out of it, and also developing what we call the theory of change, which comes with pillars that speak to the what can be done to make integration of mental health and psychosocial support even more effective, reacting and intervening on the challenges that have been faced by the continent. In just a short while, I'll just share a brief, I think it's 4 or 5 slides, which speaks to the findings and feedbacks that we got from that workshop where member states were participating with different partners. With your permission, Chairperson, I can just project my screen shortly to just show the presentation on the feedbacks from the workshop we had in Liberia with colleagues. I'll just start from the workshop summary just to give an overview of what really was happening in the training that we had in Liberia. The first thing is we had an attendance of a couple of organizations and partnering institutions, which I would say we call it the Mental Health Consortium, which is made of Africa CDC, WHO, Afro, WAHO, EXA, UK Public Health Response Team. These are some of the countries, organizations that participated in addition to the countries I mentioned, which is Cameroon, Liberia, Nigeria, and Sierra Leone. We had an attendance of more than 50 people. It was a hybrid workshop. Some were joining online and some were there physically, including myself and a colleague on the call, Rosemary, who was part of that. And as I had said, the biggest objective of the workshop was to establish regional networks to share learnings and expertise on different emergencies in the continent, on how we have been responding as a continent to that. And in addition to that, it was also to develop the theory of change for integrating mental health into national emergency prepared and response plans. That was the biggest of all the objectives we had for this meeting. And from what transpired in the meeting was most of the key barriers that the participants made obvious to us were that in order for us to integrate MHPSS into emergency preparedness, the biggest problem was the lack of political will. You would remember that earlier on I spoke about the importance of the African Union and its political power and the political will it yields in terms of influencing member states to have certain things going on within their different countries in respect to health. And the other barrier that we realized was the deprioritization of mental health during emergencies. We have seen this, and it was only until COVID-19 that we really had our eyes open that actually mental health is very important when you want to respond to emergencies. And then we had lack of funding. That was a very big one, because in order for us to do anything, you technically need to have the resources to make it work and make it happen. And the lack of availability of trained staff to provide MHPSS activities, and also the non-existing and weak or pre-existing mental health systems, which speaks to basically how mental health has been neglected for over these decades that we have been dealing with emergencies, dealing with strengthening health systems. We have been more predominantly focused on these other issues. And speaking of the positives that came out of this workshop, it was one of the biggest things that we need to have a way to integrate mental health beyond the emergencies. We should not say we are responding to COVID-19 and this is what we're going to do. And once we feel like COVID-19 is no longer an emergency, we withdraw the resources on mental health, we withdraw the resources on all the aspects that require funding or resources for sustainability of mental health. So the other big thing was speaks to sustainability of the systems that we are developing, because we should not develop systems that at the end, it's like we're going on and then we say, okay, this finishes here, we stop. And then we have to reinvent the wheel over again and again and again. So these are some of the things that really came out strong from the meeting we had. And I'm not going to be reading through because I have already indicated some of them. And these are as they appeared when we were developing what we call the theory of change, as it is exhibited in this diagram I have here, which literally speaks to the integration of MHPSS into emergency response and preparedness. And you definitely need to have coordination. You definitely need to have information management, funding, and human resource. And all of this, they build one thing. They build effective preparedness and they build effective response, which is also informed by health system strengthening, which is what Africa Cdc's basic mandate is all about. And once we have stronger systems, you need to have a way of sustaining the systems. And one would ask, how do we sustain the systems? We sustain the systems through collaborations, through working together, through what I would say is the multi-sectoral approach in dealing with emergencies, response, and preparedness, particularly when we want to integrate mental health into all these systems that we already have in place. I would say this is basically the long and short of it. And over and above, as Africa CDC, we have our activities looked and focused on assisting and providing technical know-how to member states on mental health support, and also on the other aspects, which is the tools to use when you're integrating mental health into emergency preparedness and response, the collaborations, the networks, the pool procurement in terms of even resource mobilization, because as a coordinating body of public health, as in the African Union, we have a mandate to coordinate these activities within the African continent. And that's the biggest activity we have. And right now, the biggest success we have is we now have a document which is going to be a driving force behind all of what we are speaking about, putting actions on the document and taking a lot of implementation activities down into the ground, influencing member states to drive their policies, to drive their national emergency preparedness plans to what we envisage as the proper national emergency plan, which has MHPSS as the pillar in it beyond the emergency for sustainability purposes. Thank you so very much. I'll end right there. Thank you so much.